Hello, my name is Kirsten Graham. I'm the mother of 7-year-old Emmy. My personal experience as a parent of a child who suffered 5 years before being properly diagnosed with a sleep disorder reflects the tremendous burden that missed sleep problems have on both the patient and their family. Along the way, she received 4 different mental health diagnoses and experienced a severe adverse drug reaction to a pharmaceutical treatment. A functional sleep-wake behavior assessment developed through the Sleep-Wake Behavior Research Lab at BC Children's Hospital ultimately recognized her underlying sleep disorder. With this clear understanding, we were able to work with her medical team to put an end to her suffering.
Hi, my name is Berger.
And I'm Duncan Wong. We're co-op students studying at the University of British Columbia. Since starting here in the Sleep-Wake Behavior Research Lab of BC Children's Hospital in May 2013, we have learned a lot about functional assessments. We came here not knowing much about the significance of sleep, let alone the concept of functional sleep-wake behavior assessments. However, in the last year, we have had the privilege of interacting with dozens of families and hearing their stories, and seeing what a functional sleep-wake behavior assessment looks like in person.
So functional assessments are the foundation for individualized clinical assessments. They are a form of explorative, semi-structured interviews which respects you, the parent, as accurate historians and incorporates your narratives into our clinical and professional history taking. For us, the concept is especially important to develop a shared language and collaboratively build up a hypothesis because everyone perceives sleep-related problems differently.
In summary, functional sleep-wake behavior assessments are conducted by using guiding questions and exploring them. Based on this, our team has adapted the concept to a simple bookmark and a digitized app. The bookmark supports self-assessment and advocacy of your family's sleep problems, and the app further supports through data collection.
Recently, we tested the user-friendliness of these in an outreach clinic in Kamloops, where we taught this concept to respiratory therapy students at Thompson Rivers University. These comprehensive assessments took only 1 hour at the outreach clinic. The response of the students and families and our own experience confirmed that functional sleep-wake behavior assessments promote active listening, structure the conversation, and let families share their story.
We all know the basics of language as the ABCs. Here, we will be teaching you the ABCs of conducting a functional sleep-wake behavior assessment.
Application: General Functional Sleep-Wake Behavior Assessment Information. The guiding questions are designed to ask you, the parent, about your child's sleep problems. If your child can be included, for example, age appropriate, we encourage you to review the questions with your child.
From a parent's viewpoint, sleep and sleep problems can be a sensitive topic of discussion within your family. You may have many different perspectives within your family. Don't force them to come to a consensus. You are trying to collect a general picture of the various perceptions.
Think of a typical week in your child's life when reviewing the questions.
Our functional sleep-wake behavior assessment is based on the BEARS screening concept, with focus on the 5 domains which affect sleep-wake behaviors. B is for bedtime, E, excessive daytime behaviors, A, awakenings, R, regularity or routines, S, sleep-disordered breathing.
We conceptually broaden the BEARS domains and explore and ground the gathered information with the well-being of the child and his or her parents and their family ecology. The Sleep-Wake Behaviors app operationalizes the revised concepts and gathers data in a safe and modern way.
Using the bookmark. The bookmark provides handy and concise guiding questions following the BEARS screening concept. For self-assessment of your child's sleep, the bookmark asks how you and your child's quality of life is affected by sleep problems. It also encourages you to consider best and worst case scenarios. For example, what is the going to bed situation?
Using the app. The app is a digitized version of the BEARS-based guiding questions found on the bookmark, which supports data collection. The app is designed so that if you press yes to certain questions, follow-up questions will pop up. The pop-up style helps to personalize the experience and direct the conversation. The app covers a total of 9 domains. In addition to encompassing the guiding questions on the bookmark, The app also collects information on functional diagnoses, medications, and background.
Most importantly, what we have learned is that observing and note-taking helps to build up the case. Keeping these records will help the assessing professional to get an idea of the entire situation and for the physician to come to a diagnosis. Build a case. After going over the guiding questions, fill out the sleep logs and diaries for 2 weeks.
Sleep logs record when your child goes to bed, falls asleep, has awakenings over the night, wakes up in the morning, naps and/or has mood changes over the day or night. Sleep logs help to create an overview of the current sleep situation. Diaries record additional details about changes in moods and sleep-wake behaviors when falling asleep or waking up. For example, are these challenging behaviors? Are these challenging disruptive sleep-wake behaviors? The diaries also record the nature of events and situations over the day or night. Questions on the diaries help you to objectively reflect, prepare, and structure your narratives at the follow-up assessment.
From a parent's viewpoint, sleep logs and diaries help to take a step back and take an objective look at a situation which has become the norm. This is an especially important step if the problem has been long-term or chronic. Sleep diaries are an optional tool to add additional comments and highlight areas that you see as significant collateral information.
Communicate. After filling out the sleep logs and diaries for 2 weeks, discuss what you have observed and explored with your family and an involved professional that supports you. Speak about you and your child's affected well-being. Set up an appointment with your child's pediatrician or family physician and bring your gathered information, including your notes, observations, answers to the guiding questions, and sleep logs/diaries.
The functional sleep-wake behavior assessment and clinical assessment results will be discussed. The guiding questions are also a good tool for monitoring medication effects and/or side effects, as over-the-counter and/or prescription medications may impact sleep-wake behaviors. We are eager to hear your feedback to optimize our concept and teaching concept.
Maya and Duncan have taught you the basics of a functional sleep-wake behavior assessment. As a parent, I believe it's important to highlight the functional sleep-wake behavior assessment guiding questions should not be used as a checklist, but as a tool to grasp a fuller clinical picture, which will help formulate an intervention plan that reflects each individual's family's situation and priorities.
One of the key outcomes when you use mental health medication or medication for sleep is to continue to look at issues relating to harm. And it's not so obvious. Sometimes drugs cause behavioral adverse drug reactions, things that change a child's behavior for the worse. So we might see aggression, we might see sleeplessness, we might see irritability, frustration, confusion. Those are the kinds of things that you need to watch for as a parent.